Great. Thanks, Dr. Bocking.
Great. Can you hear me okay?
Yes, we can.
Okay, great. Well, good afternoon, everyone. Thanks for joining our session this afternoon. As Chandra mentioned, my name's Natalie Bocking. I'm the Medical Officer of Health with Haliburton Kawartha Pine Ridge District Health Unit, and we have been hosting these weekly media information sessions on COVID-19 for a few months now. And so thank you for continuing to join us and for sharing this information out more broadly. So I actually have a couple of slides that I wanted to share today. Quite a lot of moving pieces to COVID activity and COVID response right now. So wanted to break up my talking a little bit with some other visuals. I know for folks that have joined in by phone, certainly you'll be able to access them or see the slides from our YouTube recording. Or if there's any specific information that you're looking for, you can also connect with Chandra or Bill, and we can get you that information if we're able to. So you'll have to bear with me for a second as I share my screen. And I will just double check with Chandra that you're able to see my slides.
Yes, we can. Thank you.
Okay, great. So essentially, I mean, today's session is similar to our previous information sessions. We're going to talk a little bit about the epidemiology or numbers of COVID and COVID activity across our region. A couple things and updates regarding testing, updates on vaccination efforts, a very quick touch base on enforcement, and then wanted to spend a couple of minutes just talking about what we might expect in the upcoming weeks in terms of changes to some of our public health practice in response to COVID-19, and in particular in response to the Omicron variant. And then certainly ending with a couple of key messages for the holiday season. So with regards to epidemiology, since the start of the pandemic, we've had a total of 2,847 confirmed cases of COVID-19. We currently have 145 active cases or cases that are not resolved. 8 in the County of Haliburton, 52 in City of Kawartha Lakes, and 85 in Northumberland. We have had a significant increase in newly reported cases in the last week. And so I've shared this graph with you because I think it demonstrates it pretty well. This is a graph that is on the vertical axis or the y-axis. That's the crude rate or 7-day rolling incidence rate that we often refer to. And on the x-axis or the horizontal axis at the bottom is by time. So this is really showing us pictorially what the weekly incidence rate has been since the start of the pandemic. So you'll see the first wave, the line go up, then you'll see the second wave, the line go up, and then you'll see the third wave and the lines go up, and then you'll see this most recent increase. So today, our 7-day rolling incidence rate is at 82.8 cases per 100,000 population. This has more than doubled in the last week. We are fully expecting this to continue to increase. This increase right now is a reflection of both Delta variant as well as Omicron variant. We have had a total of 17 lab reports that have been positive for the screening test for Omicron, which is called the S gene target failure. So we have had 17 of those positive reports now, but still a significant number of Delta variant cases that are being identified. What we know from looking at other jurisdictions or other areas of the province, once it becomes primarily Omicron, this line really goes up at an even steeper rate to a much higher 7-day weekly incidence rate. So here you see us sitting at 82. Kingston region, their weekly incidence rate has been up around and higher than 450 cases per 100,000 population. So really more than 4 times what our number is here. So certainly off our graph, and we'll have to be adjusting our graphs as our rate continues to go up. With this activity, we've continued to have new outbreaks declared. So I'm just going to go on to the next slide, which it talks about a couple of additional indicators we look at. So this is specifically for the week of December 13th to December 19th. On the left-hand side, we have a list of a number of different indicators that we follow on a weekly basis to give us a sense of where things are at with COVID activity. On the far right-hand column, where you'll see the box that's filled in with yellow, is the week before this, so we're comparing to that week, and then that middle column that says beyond capacity is the most recent week, so December 13th to 19th. You'll see that this is already a couple of days because this only goes to December 19th. This is already a couple of days out of date because it has our incidence rate here at 58 cases per 100,000. But today, because we have continued to increase, we're at 82 cases per 100,000. The things that I really wanted to highlight here, and I'm noticing, so our active outbreaks currently is sitting at 5. We did have a number of outbreaks declared over. Our per test percent positivity, which is down at the bottom of this graph, second from the bottom, has continued to increase and most recently calculated at 4.6% for test positivity. And then the other thing that we look at is the volume of calls coming into our call center, which is also a reflection sometimes of the number of different provincial announcements that are happening. But we've also continued to see an increase in call volume to our call center. So I'm gonna hit escape for a second and just bear with me for a second as I'm going to stop sharing my screen for a second, just so that you can see me, and I will end up going back to the presentation, so you'll have to bear with me for a minute. A couple of other details just to share related to the epidemiology. In the last 14 days, so looking at characteristics of cases identified in the last 14 days, we have had 230 new cases. 16% of those cases have been in the age group of 20 to 29, and 15% have been in the age group of 50 to 59. When we look at, I guess, source of transmission or how cases are identified, 21% have not had an identifiable source of transmission, 11% household contacts, and 13% close contacts. However, there's a large amount of information that we're still collecting. As we continue to see a higher case volume, that moves us really beyond capacity to do the same level of case management, case investigation that we were previously doing. We won't have all of the details that we've previously had, and so there's a lag in our ability to gather that information because there are so many cases we can't reach all of them. There are a number of changes that have been recently made to our case and contact management process, partly as a reflection of changes we are making locally due to increased case volume. Also, though, related to provincial direction, given provincial case volumes. So one of those changes is that we are no longer identifying and notifying high-risk contacts. So when cases are identified, those cases are given a letter and information for them to give to their anyone that they have had close contact with. They are high-risk contacts. And that change is something that's quite consistent with many other health units. In addition, the majority of new cases that are identified are actually being forwarded on to the provincial workforce or a provincial program that will follow up cases as well. And this provincial workforce was created partway through the pandemic to support health units that were seeing case volumes beyond their capacity to respond to. So at the health unit, we're continuing to do case management follow-up for any individuals under the age of 18 or any other high-risk settings such as long-term care homes, retirement homes, group homes, but other average community identified cases are being followed up by the provincial workforce. And so people might be contacted by the province as opposed to the health unit. A couple of, I guess, reminders related to that in terms of how it will affect our dashboard. We will no longer be reporting on the number of high-risk contacts identified because we won't have that information available as we're not identifying those high-risk contacts. I also wanted to make you aware that we will not be reporting every day over the holiday period. There will be some days that our dashboard will not be updated, including the stat holidays, but we will endeavor to ensure that it's done at least every couple of days to keep people informed, and then resuming on a daily basis with except for weekends after the holiday period. So bear with me, I'm going to share my slides again. So I wanted to give an update on really our public health COVID-19 toolbox. And so this is really some updates related to what we're currently doing. When we think about non-pharmaceutical interventions, there's a number of things that we talk about and we emphasize. So individual behaviors and practices such as masking, physical distancing, staying home if you're sick, even if you have mild symptoms. All of these really continue to be some of the most important measures that we can be doing. The key with masking is that it's a tight-fitting mask, and we continue to have a mandate in place related to masking for indoor public locations. The other non-pharmaceutical interventions, so case and contact management, outbreak management, I spoke a little bit about what we're currently doing related to that and how this is having to be modified in response to the Omicron variant in particular. And then there are public health restrictions that continue to be in place. We have provincial restrictions under the Reopening Ontario Act with some new restrictions that came into effect on this past Sunday, December the 19th. And I think we will be continuing to monitor on a day-by-day basis the need for additional restrictions, whether it be locally or at a provincial level. I included here just a reminder that there is a Section 22 class orders. So essentially it means that if you have been identified to have COVID-19 or if you're a high-risk contact of someone that has COVID-19, regardless of whether or not you have 2 doses of vaccine, you're required to isolate for 10 days, and that class order is available on our website. It's been in place for many months, since close to the beginning of the pandemic. Usually what happens is that if someone's identified to have COVID-19, when we talk to them, we remind them of this class order, remind them of their requirements under the order. But as we will not be connecting necessarily with all cases directly from the health unit, I think a general reminder to everybody of those requirements and the need to continue to follow them to keep our community safe. And then finally, a couple of comments related to vaccination. And I'm going to stop sharing again for a second, and you can feedback to Chandra or Bill at the end of the session whether or not this idea of going back and forth between slides and my picture is a good thing or a bad thing. But I think trying to break up just the verbal update. So with regards to vaccination, we continue to update our vaccination dashboard, although I think that we're aware of some of the assumptions that we had made previously, such as 2-dose coverage, are not as relevant given what we know about the Omicron variant. Certainly continuing to follow on a daily basis what emerging data is demonstrating regarding the effectiveness of vaccines for Omicron variant. And I know there's some more recent data coming out of other jurisdictions demonstrating that a booster dose of an mRNA vaccine for COVID-19 does provide additional protection against symptomatic illness of COVID-19, with 2 doses at about 35% protection, and with a booster dose up to 75% protection. Still not 100% protection, and so that underscores the ongoing need for people to continue to follow all of these basic public health measures that we have been doing for so many months now. With regards to coverage across our region, so for 2 doses of vaccine among people that are age 12 and over, we're at 85.1%, or that was our coverage as of Monday earlier this week. In terms of eligibility, a reminder, I think everyone's well aware, but 5 to 11-year-olds are eligible for their first dose of COVID-19 vaccine, and that is specifically the Pfizer pediatric formulation of COVID-19 vaccine. And then eligibility for booster doses of vaccine expanded to include anyone age 18 and over just this past Monday. Now, I think we find ourselves in I guess a context very similar to about 8 months ago, 9 months ago, where we had a significant mismatch in terms of high demand for vaccine and limited availability of vaccine. The difference this time in terms of the availability of vaccine is just as the human resources required across all of the healthcare system to create enough appointments for COVID-19 for the vast number of people that became eligible to get a booster dose as of Monday of this week. Not only did the age eligibility change, but also the interval between a second dose and a third dose changed to a 3-month period of time, or 84 days, in comparison to the previous 168 days or 6-month interval. So this really created a very large demand for vaccine. In response to that, the health unit has been working, I'm trying to think of the right word, furiously to try and expand capacity to the best of our ability. We already had appointments in the provincial booking system that were almost fully booked before eligibility expanded. We have added an additional 6,500 appointments through the provincial booking system for the rest of this month, so for this week and next week. However, my understanding is that almost all of those appointments are also full at this time. There's a number of other partners that are looking at expanding their ability to support vaccination efforts. I know that pharmacies are doing the best that they can, many of them quite stretched in terms of their ability to offer COVID-19 vaccine. Similar things with primary care, with their working to provide COVID-19 vaccination appointments, but also limited in terms of their capacity sometimes with health human resources. And then previously, hospitals were able to support this initiative significantly, but at this time find themselves in a position where they're already dealing with a surge in just general healthcare usage and not able to support vaccination the same way. So I think all of this, to sum up, to say that I think all across the healthcare system, we are all working as hard as we can to make vaccine available. There are challenges, and the reality is that we'll have to be patient in terms of trying to access. There's just not enough capacity to meet the demands of a full 18 and over eligible for a booster dose at a 3-month interval. We have posted all of our appointments and clinics available through to the end of January. We're continuing to try and hire new staff to support further clinics. But this, as you know, this is an ongoing process, and we reevaluate on a daily basis. I think not only have we had some challenges just related to capacity and the large demand for vaccine, there's also a couple of other things to be aware of related to vaccine. So at our immunization clinics, people will primarily be offered Moderna vaccine for their booster dose unless they are under the age of 30, in which Pfizer is the recommended product. We've been notified by the province that there is a delay or a shortage in Pfizer shipments to the province, and so all Pfizer that's available in Ontario has already been distributed out to health units, and we do not have a next delivery date for Pfizer. So we are asking individuals that if they're coming for their booster dose and they're eligible to get Moderna, that they receive Moderna as the vaccine that's available at that time, in order to make sure that we do have some Pfizer available for people that are under the age of 30. So lots of ongoing changing pieces related to COVID-19 vaccination. Again, we ask for people's patience. A reminder to book an appointment. We are not accepting walk-ins for booster doses at any of our clinics. We know there have been lineups at some of the clinics, and sometimes lines are associated with people that don't have an appointment and are trying to walk in. So really trying to get that message out so that we're not disappointing people that might think that that appointments are available, or sorry, that walk-in appointments are available at our clinics. So I'm going to move just to a couple of updates around testing and the direction really that the province is heading. And I'm just going to go back to sharing slides again for a minute. And okay. So expected upcoming changes. Now, I know that I don't want to put Derek on the spot, but often asking me to look in the crystal ball and what we can expect to happen. And I don't know for sure, but there are some things at this point in time that I think we can expect and start to shift our mind around so that we know that they're coming. One of these is in relation to case and contact management. So I spoke already that we are making changes to our follow-up for cases, and we are not doing contact tracing ourselves unless it's a high-risk vulnerable setting. We are expecting that when Omicron is the dominant variant in our region, our case numbers will increase so significantly that we will likely be unable to notify everyone that is reported as a new case of COVID-19. Given that demand on resources, we will be moving to prioritize high-risk settings and outbreaks as part of that case management. We're not there right now. We're still continuing to follow up where we can and referring other cases to the provincial workforce. But should we see what I think we're expecting to see related to Omicron, we can expect further changes to case management for COVID-19. The other piece, I think, is related to testing. We know that our system is already starting to be stretched related to access to lab-based PCR testing for COVID-19. We have heard from the province that as the surge of cases for Omicron continues to increase, they are looking at prioritizing what PCR testing capacity there is for certain high-risk settings and essential workers to ensure that the acute care system, long-term care homes, other essential workforces are able to continue to work, and we are protecting these workers as best as we can and enabling them to continue to work and respond to the pandemic. If that becomes the case, where your average community member that thinks that they might have COVID-19, or if they have symptoms that could be COVID-19 and they're not able to get a PCR test, really the message becomes, if you are sick, even if it's mild symptoms, if it's a runny nose, assume that it's COVID-19, assume that it's Omicron, and isolate for 10 days. And I know that there are some health units that are starting to move in that direction. And I think we need to start to shift our thinking around this as how we respond to Omicron. We're needing to adapt just based on the volume of cases that we're expecting. Further to that, I think we've had a lot of, we've seen a flurry of activity really related to rapid antigen testing, lots of demand for rapid antigen testing. And what we're now facing provincially is potentially a shortage of rapid antigen tests. And so when our system to do PCR lab testing becomes saturated and it becomes prioritized, the government is also looking at prioritization for rapid antigen testing and using rapid antigen testing to, again, continue to enable workers in those high-risk settings to continue to work. So for healthcare workers, long-term care home workers, this sort of thing, to be able to protect that workforce capacity, which will be needed to respond to COVID-19. The rapid antigen testing program is administered centrally through the Ministry of Health. We've certainly received lots of questions to the health unit related to, do we have rapid antigen tests? How can we get a rapid antigen test? The health unit has not received, we don't have any rapid antigen tests. Again, it's all distributed centrally, but we are continuing to follow the, I think, provincial announcements related to rapid antigen testing as it changes on a regular basis in the next couple of days. So I'm going to stop sharing my screen again. I wanted to end with a couple of, I guess, a couple of reminders, and I don't think there will be any surprises here. I think COVID-19 continues to challenge all of us. It challenge the public health system, challenge our acute healthcare system, and challenge us as communities and a society to adapt in how we're thinking about COVID-19 and how we're living with COVID-19. And ironically, we find ourselves again in a holiday season where we would typically be gathering with loved ones, friends, family, at a time where we know that that's not in the best interest of our community, given what we know about Omicron in particular and how it circulates. And it's, I think, what we're predicting to see in terms of the volume of cases. So really, message for the holidays continues to be small, smart, and safe. Small gatherings, really just your household, if you're able to, or one other household, and smart that you're and safe. You're looking at the practices that you do have in place. You're ensuring you have a tight-fitting mask. You're following the other public health restrictions. If you're at a small gathering, you're looking at where that location is, what the ventilation is. If you can open a window, that's great. But I think we need to be aware that in the next couple of weeks, we're going to see significant COVID-19 activity. And I think ultimately what we are doing now today by following public health restrictions and by getting vaccinated, we're not stopping Omicron and COVID-19, but we're slowing it down and we're helping to reduce what the impact will be on the acute care system, our emergency departments, our hospitals in January, because that's when we will see the impact of this. Otherwise, wishing everybody a happy holiday season, and I will stop there and happy to take any questions.
Okay. Sorry, my dog's joined me here. He'll probably make some noise. I'm just looking for some hands. I don't see any at this point. I think there was a lot of information and a lot of things to digest. So no, it's always good to get the information out and have our partners help communicate that to our community members. So just looking for any hands. Any members of the media? Mark's popped his hand up. Okay, Mark, do you want to go ahead?
Thanks for all the information, Dr. Bocking. I'll start with one question, and then if there's more hands, I'll go to the back of the line and ask my second question. Just wondering if the dashboard will soon be updated to show how many people have received their booster dose, as it currently now displays the first dose on the first, second, third, or first week, fourth week in total. Just wondering if the dashboard is going to update the booster dose as well.
Yeah, thanks for that question, Mark. We'll take that back with our data team. We are including one graph that does include the booster doses, but I think it's not as obvious or easy to read. So I think as we're moving away from this idea that 2 doses is enough and we need 3 doses, that we'll look at adapting the dashboard. I don't have a timeline on that, just given some of our current competing priorities and pressures, but we will take that back.
And I'll go to the back of the line.
No, Mark, go ahead. Ask your second question. That's fine.
Okay. Interviewed Cobourg Mayor John Henderson earlier this week, and he stated that the health unit has taken over more space at the CCC to expand it. Can you give us explain how many people you're hoping to be able to do on a daily basis in that facility if there's vaccine available, I guess?
Yeah, certainly. So at this point in time in vaccine rollout, we are trying to find the largest space that we have to put through the highest volume of people with the minimum number of staffing, really trying to make the most of our resources to see the highest volume come through. So the CCC, we will be using the entire gym. We were previously using half the gym. Rink not currently available, but I think we'll see the same throughput through the gym. We're looking at approximately at least at a minimum 700 appointments that we can see through in a day. I know that for the next 2 weeks, there are also evening clinics that are being hosted there by the Northumberland Family Health Team, Northumberland Hills Hospital, a partnership there. So I think having that space has been enabled us to really bump up at least double appointments, and for the next next 2 weeks at least, almost triple number of appointments available there. And we're quite thankful to the town of Cobourg and the residents, as we know that this impacts community programming. And the hope is that this is a shorter term initiative, and we'll see ourselves back to more regular programming in February or March.
Thank you.
Okay, I've got Derek next. Derek, do you want to go ahead?
Good afternoon. Love the crystal ball reference. Thank you. I just a simple question here. Do you have any insight? We've heard rumors in the media of fourth doses for certain people. Could you attest to that?
So I have heard conversations, certainly among the population that is considered to have a compromised immune system. So those individuals that were able to get a third dose earlier, considered part of that primary series. It wasn't even considered a booster. They needed 3 doses to get that same response. And so now you're looking at potentially a fourth dose, which might then become equivalent to the booster, what the rest of the population has been getting as their booster dose. I think we're waiting on the final confirmation in terms of intervals. So what the amount of time would be from a third dose to that booster dose for this population. And I think once we see that, we'll start to be able to accommodate as much as we can those individuals needing a fourth dose. I've seen other jurisdictions, or certainly seen in the media, other jurisdictions outside of Canada moving to broader fourth doses among the general population. I've not heard discussion of that in Ontario at this point in time. I think the focus is still on getting out booster doses for general population.
Fair enough. And the other question, it's more general, I think, but we've seen that the Delta was more transmissible. Now we have Omicron, which is even more transmissible. What is making these more transmissible?
So I don't know that I have a clear answer for you, Derek. I mean, when viruses mutate, they'll have hundreds of mutations, and most of the time the mutation doesn't really help the virus. The virus, ultimately wants to improve itself because it wants to survive longer in the environment. So it's better for it if it's more infectious, and those more infectious mutations end up becoming the dominant variant. And so over time, we might see a more infectious variant. But I think that there's a lot that we don't fully understand, and scientists are continuing to follow and determine and what answers are to some of those questions.
Sorry, so would it be fair to say that it's not necessarily more transmissible, rather it's just more potent?
That's a good question, and I don't know. I don't know if that's a fair. I think it depends on who you talk to, if it's an epidemiologist or if it's an infectious disease specialist.
Crystal ball time.
Yes.
Thank you.
Okay, great. Thanks, Derek. I'm going to turn to the chat now because Cecilia has put a question in the chat. And she has said, you painted a picture of January. Any ideas what February might look like?
So I don't know for sure. We can make some, educated guesses or estimates based on what we do know about COVID. So we know that usually cases go up, and then a couple of weeks later, we see hospital admissions and ICU admissions go up. I think we know from the third wave that hospital admissions and ICU admissions, depending on how long people have to stay in hospital for, can stay high for quite some time, like one to 2 months. So I think by February, we're likely to see actual case numbers coming down, but we could still be seeing quite a high volume or pressure on our healthcare system in terms of hospital admissions and ICU admissions. And again, kind of best educated guess. We know that because Omicron is so much more infectious and it's causing our case numbers to go up so rapidly, the question is, will they come back down that much more rapidly? And we see case numbers that period of time be a little bit shorter than previous waves. But again, a lot we don't know at this time.
Okay, that's great. Thanks, Dr. Bocking. Cecilia, if you have another question, maybe just pop it in the chat. I'm going to go to press. I think that's Sue. Is that you, Sue?
Hi, it's me.
Okay. Do you want to go ahead?
Sure. Hi, Dr. Bucking. My question today is about rapid tests, and I believe that the general community thinks that they can take a rapid test and then visit people at gatherings over holidays. And so I'm just asking if that's the way it works, or if you would like to speak to how rapid tests work and how we can best be using them.
Mm-hmm. So it's tricky because I think prior to Omicron, we were really hoping that wider availability of rapid tests could be used really to enable people to attend more social gatherings over the holidays. I think with Omicron and knowing how infectious it is, certainly we know that rapid antigen tests are not 100%. They're not perfect. They're kind of 60 to 65% sensitive. So not always certainly detecting virus. It could just be if somebody has COVID-19, the virus level is not high enough just at that point in time that it tests positive. I think that right now, and as we move into the holidays, I would not be counting solely on rapid antigen tests to really attend all of the same gatherings that you had in mind. I think at this point in time, we need to go back to revisiting gatherings kind of full stop and be looking at small gatherings and other public health practices to help keep us safe. If you have access to a rapid antigen test, I think you would want to use it right before you attend a gathering so that you know that really you're capturing it at the most relevant point in time just before you do go. But if you have any symptoms, if you've had any exposures that you know of to somebody else that could have COVID-19, then I wouldn't count on that rapid antigen test and I would be staying home and not attending.
Okay, great, thank you. And then can you also speak to, if you do test positive on a rapid test, what would be, should you then go to get another test, or is it necessary to report it still? What's the value of reporting it, I suppose?
Mm-hmm. Yeah, so certainly our message has been and will continue to be until there's not that capacity in the lab system. But the message has been, if you test positive on a rapid antigen test, that it needs to be confirmed with a PCR test at an assessment center. Now, if you are not able to get a testing appointment at an assessment center, as we anticipate that will soon become the case, then assume that test is a true positive and that you need to isolate for 10 days from that positive test. At this point in time, if you have there are certain settings where we would, where at the public health unit, we want to know if there are positive rapid antigen tests, certainly in long-term care homes, school settings, this sort of thing. And I think from a system perspective, we're still determining what the approach is going to be as we transition potentially away from widespread access to PCR testing to rapid antigen testing.
Thank you.
Okay, great. Thanks, Sue. I see Derek has his hand up. Derek, is that an old hand or is that a new one? I'm thinking it's an old one. You there, Derek? I think we've lost Derek. Oh, I've got Jessica now. Jessica, why don't we turn to you then?
I just wanted to take an opportunity to say thank you, Dr. Bucking, for everything you've provided us with and making time every week. And I actually didn't have questions today because you provided so much information. So I just wanted to say thanks and wish you and everybody at HKPR Merry Christmas or Happy Holidays.
Thanks very much, Jessica. We appreciate it. And we appreciate everybody here being able to share information. And we know that we won't always get everything 100% right at the health unit, but we certainly are continuing to try. And when we have information, we want to ensure that people have accurate information in the community as well.
Okay, great. That was very nice of you, Jessica. I don't see any other hands. I still haven't heard from Derek, so I'm assuming it's an old hand. And let me just check the chat to see if Cecilia added anything else. No, I don't see anything. So I think we might be at the end. So I'm going to say that this is probably a wrap on our final media information session for 2021. I've lost count of how many we've had. Bill would know off the top of his head, but I don't know. But I think what our plan is that we are probably looking at, oh, Bill's 45, Bill says. So I think our plan is to bring them back the first week of January, but we'll confirm for sure, and we will send out new invites for the next series starting in 2022. So on that, I'd like to thank everybody and wish you all a wonderful holiday, and thank Dr. Bocking for her time, and appreciate all the information that she provides to us. So thanks everybody, and we'll see you after the holidays. Take care.
Thanks again. Have a great break.
Thank you.